Think about the last time you tried to take your rings off at the end of the day and they simply would not move past the knuckle the way they used to. Or the morning you woke up and made a fist and felt your fingers push against themselves, tighter than the night before, tight enough that you noticed it, but not tight enough to worry about it. You flexed your hands a few times, ran them under warm water, told yourself you'd slept on them wrong or eaten something salty the night before, and by the time you'd had your coffee, it had mostly settled down or settled down enough that you stopped thinking about it. You have done this more times than you could count over the past year or two, and each time you filed it under something small. Weather, salt, sleeping position, age, because swelling in the fingers seems like the least alarming symptom a body can produce. It doesn't hurt, usually. It comes and goes. It seems cosmetic, an inconvenience rather than a message. What nobody has told you is that the fingers are one of the most sensitive early warning systems the body has for fluid regulation, and that swelling appearing there specifically, rather than elsewhere, points toward a short list of underlying processes that a physician can often narrow down within minutes simply by asking the questions you have never been asked because you have never brought this up as something worth mentioning. Here is why the fingers specifically are where this shows up first. The tissue in your fingers sits at the farthest point from your heart, supplied by small peripheral capillaries operating at the lowest pressure point in your entire circulatory system, and the skin covering the fingers is thin and tightly adherent to the tissue beneath it, with very little room for fluid to accumulate before it becomes visibly and physically apparent. Dr. Suzanne Steinbaum, a cardiologist who has written extensively on peripheral fluid retention in women and older adults, has explained that the fingers function as a kind of pressure valve for the body's overall fluid balance, registering excess fluid volume before it becomes apparent almost anywhere else, which is precisely why finger swelling frequently arrives as the very first physical sign of a process that has already been building elsewhere in the body for some time. The fluid causing that tightness is not fat and is not muscle. It is extracellular fluid, plasma, that has moved out of the capillaries and into the surrounding tissue faster than the lymphatic system can drain it back. And the reason that fluid accumulated there in the first place depends entirely on which of several distinct mechanisms is driving it. The first and most common cause in adults over 60 is a change in how the kidneys are managing sodium and fluid balance, a shift that becomes more likely with age as kidney filtration capacity gradually declines and the kidney's ability to excrete excess sodium efficiently diminishes with it. Dr. Steinbaum's colleagues in nephrology have documented that a kidney operating at reduced filtration capacity retains sodium more readily than a younger kidney processing an identical diet, and retained sodium pulls water with it osmotically into the surrounding tissue, producing the generalized, symmetrical swelling across both hands that is the hallmark of a sodium and fluid balance cause rather than a localized joint or circulatory problem. This pattern typically worsens across the day, is more pronounced after a high sodium meal or after a period of prolonged sitting, and responds, at least partially, to elevating the hands above heart level, a simple bedside test that helps distinguish it from causes that do not respond to gravity at all. The second cause, and one that carries real cardiac significance in this age group, is early-stage heart failure, specifically the type in which the heart's pumping efficiency has declined enough that blood returning from the extremities backs up slightly in the venous system before it can be efficiently returned to circulation, elevating pressure in the small veins and capillaries of the hands and forcing fluid out into the surrounding tissue. Dr. Clyde Yancey, Chief of Cardiology at Northwestern University's Feinberg School of Medicine and a past chair of the American Heart Association's Writing Committee on Heart Failure Guidelines, has written that peripheral swelling is frequently among the earliest external signs of declining cardiac function, often appearing before the shortness of breath and fatigue that patients and physicians typically associate with heart failure, precisely because the extremities are where fluid backup becomes visible first. What separates cardiac-driven swelling from the sodium and kidney pattern is that it tends to be accompanied by swelling that also appears in the ankles and lower legs by the end of the day, a subtle but measurable weight gain of 2 or more pounds within a week from fluid retention alone, and in more advanced cases, a mild persistent cough or new difficulty lying flat comfortably at night. Details that, taken together with hand swelling, meaningfully raise the priority of a cardiac evaluation. The third cause is one specific to the joints rather than fluid balance broadly, and it is inflammatory arthritis affecting the small joints of the hands, in which swelling clusters specifically around the knuckles themselves rather than spreading evenly across the whole hand, frequently accompanied by warmth, stiffness, lasting beyond an hour in the morning, and in rheumatoid arthritis specifically, Symmetry between the left and right hand. Dr. Ian McInnes, whose research on inflammatory joint disease has already established the connection between prolonged morning stiffness and active synovial inflammation, has noted that swelling localized specifically to the knuckle joints rather than the fingers as a whole is one of the more reliable visual distinctions between an inflammatory joint process and a fluid balance process, since inflammatory swelling tends to create a visibly different contour around each individual joint rather than a uniform puffiness across the entire finger. The fourth cause, less commonly discussed but increasingly relevant in this age group, is a side effect of common medications that most patients never connect to the swelling they are experiencing because the swelling began gradually, weeks or months after starting the medication, well outside the window. Most people associate with a new drug reaction. Calcium channel blockers, including amlodipine, sold as Norvasc, one of the most widely prescribed blood pressure medications in the country, cause peripheral vessel dilation as their primary mechanism of lowering blood pressure, a mechanism that, according to research published in the Journal of Clinical Hypertension, produces measurable peripheral edema in a meaningful proportion of patients taking the drug long-term, with the hands and fingers among the areas affected. Dr. Franz Messerli, a hypertension specialist whose research has been widely cited in cardiology literature, has documented that this medication-induced swelling is frequently misattributed by both patients and physicians to dietary sodium or aging rather than the medication itself, because the connection is rarely made explicit at the time the prescription is written. The fifth cause, and the one most specific to women in this age group, is the hormonal fluid shift associated with declining estrogen levels, which affects how the body regulates fluid balance at the tissue level, independent of kidney or cardiac function, producing a pattern of swelling that many women describe as worse in the days surrounding hormonal transition and gradually less predictable and more constant as that transition progresses further. Dr. Joanne Manson, Chief of Preventive Medicine at Brigham and Women's Hospital and a lead investigator on the Women's Health Initiative, has documented that fluid retention is among the more commonly reported and least discussed symptoms of the menopausal transition, frequently persisting well beyond the years most women associate with hormonal symptoms and often dismissed by patients themselves as unrelated to hormones at all, simply because it does not resemble the hot flashes and sleep disruption more commonly recognized as menopausal. Here's what to actually do with what you now understand about the swelling you have been dismissing. Note whether the swelling is symmetrical across both hands or concentrated on one side, since one-sided swelling points away from the systemic causes described here and toward a localized issue requiring separate evaluation. Note specifically whether the swelling clusters around the knuckle joints themselves or spreads evenly across the whole finger, since that visual distinction is one of the most useful details you can bring to an appointment. Check whether elevating your hands above your heart for 10 minutes meaningfully reduces the swelling, since a positive response points toward a fluid balance or circulatory cause rather than an inflammatory one. Weigh yourself at the same time each morning for 1 week and note any gain of 2 or more pounds that cannot be explained by diet, since sudden fluid-driven weight gain is one of the more reliable early indicators of declining cardiac function that your physician will want to know about immediately rather than at your next scheduled visit. Bring a complete list of your current medications, including how long you have been taking each one, to your next appointment and ask directly whether any of them, particularly a calcium channel blocker, could be contributing to the swelling you are describing. And if the swelling is accompanied by ankle or leg swelling by evening, unexplained weight gain, new shortness of breath, or difficulty lying flat, do not wait for your next scheduled visit at all. Your fingers noticed this before you did. The only question left is whether you bring it to someone who knows what to do with the answer.